Vital signs taking temperature, pulse, respiration, and blood pressure. So what is vital signs taking? Vital signs taking is a procedure that provides data that reflect the status of several body systems that includes cardiovascular, neurological, peripheral vascular, and respiratory systems. The science of physiology is reflected in body temperature, pulse, respiration, and blood pressure. Measure temperature first followed by pulse, respirations, blood pressure, and oxygen saturation or SpO2. So what is the purpose of this? The purpose of this first is to assess the client's condition. Second is to determine the baseline values for future comparisons. Third is to detect changes and abnormalities in the condition of the heart.
Blood pressure taking is a pressure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. Assess the client's physical condition. Assess for factors that affect blood pressure. Determine the client's baseline blood pressure. Wash hands. Gather the equipment needed. Check the client's identification. Explain purpose and procedure to the client. Have the client rest at least 5 minutes before measurement. Determine the previous baseline blood pressure if available from the client's record. Set the position. Assess the client to a comfortable position. Be sure room is warm, quiet, and relaxing. Support the selected arm. Turn the palm upward. Remove any constrictive clothing. Position the stethoscope's earpieces comfortably in your ears. Turn tips slightly forward. Be sure sounds are clear, not muffled. Place the diaphragm over the client's brachial artery. Do not allow chest piece to touch cuff or clothing. Close the screw clamp on the bulb and inflate the cuff to a pressure 30 mmHg above the point where the pulse had disappeared. Open the clamp and allow the aneroid dial to fall a rate of 2 to 3 mmHg per second. Note the point on the dial when first clear sound is heard. The sound will slowly increase in intensity. Continue deflating the cuff and note the point where the sound disappears. Listen for 10 to 20 seconds after the last sound. Release any remaining air quickly in the cuff and remove it. If you must check the reading for any reason, allow a 1-minute interval before taking blood pressure again. Assess the client to a comfortable position. Advise the client of the reading. Wash hands. Record blood pressure on the client's chart. Sign on the chart. Report any finding to senior staffs. Return the instrument to proper place. Check the client's identification. Introduce self and explain procedure to the client. Close doors or use a screen. Take the thermometer and wipe it with cotton swab from bulb towards the handle. Press the button that will erase the digital numeric display. Assess the client to a supine or sitting position. Move clothing away from shoulder and arm. Be sure the client axilla is dry. If it is moist, pat it dry gently before placing the thermometer. Place the bulb of a thermometer in hollow of axilla at anterior inferior with 45 degree or horizontally. Keep the arm flexed across the chest, close to the side of the body. Hold the thermometer in place until you hear a beep sound. Remove the thermometer and read the numeric display. Record the temperature reflected in the digital display and press the button to erase the numeric display. Disinfect the thermometer. Take the thermometer and wipe it with cotton swab. Soak with alcohol from handle towards the bulb. Explain the result and instruct the patient if he or she has fever or hypothermia. Return all equipment to its proper place. Assess the client's condition. Check nature of pulse. Wash hands. Assemble the equipment. Identify the client and explain the procedure. Have the patient rest his arm alongside of his body with the wrist extended and the palm of the hands downward. Place the tips of your middle three fingers on the palm side of the patient's wrist. Rest thumb on the back of the patient's wrist. Apply enough pressure so that you can feel the pulse, not too hard, not too light. Using a watch with second hand, count the number of pulsations felt on the patient's pulse for 1 full minute. If the pulse rate is abnormal, repeat the counting in order to accurately determine its rate, quality, and rhythm. Wash hands. Evaluate nature of pulse. Record result of rhythm or force in patient's chart. Assess the client's condition. Check nature of respiration. Identify the client and explain the procedure. Hold the client's wrist just as if you were taking his or her pulse. Note the rise and fall of the client's chest. Using a watch with second hand. Check the client's identification. Explain the purpose and the procedure to the client. Close doors and use a screen. Take the thermometer and wipe it with cotton swab from bulb towards the handle. Press the button that will erase the digital numeric display. Assess the client to a supine or sitting position. Assess the patient to expose his or her air. Place the probe of the thermometer very gently at the opening of the air canal for 2 to 3 seconds. Hold the thermometer in place until you hear a beep sound. Remove the thermometer and read the numeric display. Record the temperature reflected in the digital display and press the button to erase the numeric display. Take the thermometer and wipe it with cotton swab from bulb towards the handle. Wear gloves. Position the client to seams or side lying position with the upper leg slightly flexed. Drape the clients by exposing the anal area only. Press the button that will erase the digital numeric display. Lubricate the thermometer bulb around 2.5 cm or 1 inch. With non-dominant hand, separate client's buttock to expose anus. Gently insert the bulb into anus around 3.8 or 1.5 inch. Leave the thermometer in place until it beeps. Remove thermometer and wipe off any secretion from stem towards the bulb with a rotating motion. Using a cotton ball soaked with alcohol, read the thermometer. Wipe client's anal area with soft tissue. Discard soiled articles used. Wash hands. Check the client's identification. Explain the purpose and the procedure to the client. Close doors and use a screen. Take the thermometer and wipe it with cotton swab from bulb towards the handle. Press the button that will erase the digital numeric display. Assist the client to a supine or a sitting position. Ask the patient to open his or her mouth. Place the thermometer under the client's tongue to the right or left of the frenulum deep in the posterior sublingual pocket. Ask the client to close his or her lips around the probe. Hold the thermometer in place until you hear a beep sound. Remove the thermometer and read the numeric display. Record the temperature reflected in the digital display and press the button to erase the numeric display. Disinfect the thermometer. Take the thermometer and wipe it with cotton swab soaked with alcohol from handle towards the bulb. Explain the result and instruct the patient if he or she has fever or hypothermia. Return all equipment to its proper place.